My name is Jeffrey Peipert. I'm the Robert J. Terry Professor of Obstetrics and Gynecology and the Vice Chair of Clinical Research at Washington University in St. Louis School of Medicine. We just had a paper released from the New England Journal of Medicine. The teen pregnancy rate over the last 20 years has actually declined in the United States, but it is still significantly higher in the U.S. than many other developed countries. In our paper, we show that the U.S. teen pregnancy rate among sexually active teens is about 158 per 1,000 teens. Many teens fail to use a method of contraception consistently when they have sexual intercourse. Among the methods that are used by teens include condoms, which have a 15 to 20% failure rate, and birth control pills, which we've learned over time have anywhere from a 4 to 10% failure rate per year. The Contraceptive Choice Project is a cohort study where we followed over 9,000 women over 2 to 3 years. We provided education regarding contraceptive methods, access to all forms of contraception, and provided all methods at no cost. We had approximately 1,400 teens that are followed in our project that are reported in this recent publication. We found that when you provide education, access, and no-cost contraception, we can markedly reduce the rates of pregnancy, birth, and abortion among teens. Well, the key aspect of the Choice Project was we wanted to promote the most effective methods of contraception. So we started by counseling young women and all women in the project about the most effective methods of birth control, which are IUDs, intrauterine devices, and the contraceptive implant. These methods have very, very low failure rates. When we counseled women, we started with the most effective methods and counseled to the least effective methods. So we went from these LARC methods, or long-acting reversible contraception, IUDs and implants, to pills, patch, ring, injection, and then down to condoms, withdrawal, and natural family planning. When we did that, 72% of the teens chose one of the most effective methods, either an IUD or an implant. The youngest teens, ages 14 to 17, tend to prefer the implant, while the older teens, ages 18 and 19, preferred the intrauterine device. The contraceptive implant is a small matchstick-like device that goes under the skin in the upper arm between the triceps and the biceps muscle, placed just under the skin. It releases a very low level of progestin, a hormone, and it prevents ovulation, or the release of an egg. It is probably one of the most effective reversible methods of contraception ever available. Okay. So the implant is good for 3 years, while the 2 IUDs that are available on the U.S. market today are good for 5 and 10 years. The 5-year IUD is the hormonal releasing IUD, releases a low level of progestin or hormone into the endometrium, and is also very effective at preventing pregnancy. The copper IUD is a copper-containing device put in the uterus, releases copper ions, which are toxic to sperm, so prevents fertilization. That method is good for 10 years. Of course, any of these methods can be discontinued whenever a woman desires pregnancy. In terms of the results of our project, we found that 72% of women, of teens in our project, accepted one of the long-acting reversible methods, either an IUD or an implant. As a result, we saw a marked reduction in teenage pregnancy rates. For example, compared to U.S. rate of 158 per 1,000 teens who are sexually active in the U.S., the choice pregnancy rate was 34 per 1,000. Compared to 94 teenage births in the U.S. in sexually active teens, 94 per 1,000, we had a rate of 19 per 1,000 in the Choice Project. And in terms of abortions, we had less than 10 per 1,000 teens who had an abortion in the Choice Project, compared to 41 per 1,000 in the U.S. among sexually active teens. We know that 3 in 10 teenagers will become pregnant by the age of 20 in the United States, and about 1/3 of those will end in abortion. So we know that providing no-cost contraception can reduce pregnancy, birth, and abortions. Well, honestly, this study is obvious, as in, when you provide access to contraception, especially the most effective methods, you will reduce unintended pregnancy. That sounds like a no-brainer. It sounds like it's common sense, and it is. Unfortunately, in the U.S., teens don't have universal access to birth control. Many women can't afford these methods due to either insurance coverage or lack of resources to pay for them. In addition, they don't know about these methods. Many providers aren't explaining that IUDs and implants are safe for young women. And there's access issues in terms of providers. Providers have to be trained to put in the implant and trained to put in an intrauterine device. So the three key components of the Choice Project were education, access, and removing cost barriers to contraceptive methods. Well, it's a great question, and I'm really not sure what the biggest reason is, but I think it's a combination of those three issues. One is knowledge of patients and providers that these methods are not only highly effective, but very safe. Access, they need access to providers who are willing to place these methods. And this is difficult because many young women, especially poor young women, don't go to see a doctor. They don't have access to a nurse practitioner or a primary care provider. So having access to someone who's trained to put in these methods. And lastly, the cost barriers. Yes, it's true that some of the healthcare reform will help with insurance, but still there are many, many women who are uninsured, and there are many religious-based insurers who will not cover contraception. Contraception is essential for public health. It is cost savings and reduces unintended pregnancy and allows young women to finish their education and go on to more advanced careers.